I'm Graeme Meintjes. I'm an infectious diseases physician and I am the principal investigator on the PredArt trial. I was born in Cape Town and brought up in Cape Town. I obtained my medical degree at the University of Cape Town, and I've been involved in clinical and translational research for the last 10 years. When patients have both HIV-TB infections, we need to combine the treatments for both those conditions. But one of the most common complications is TB-IRIS. TB-IRIS causes patients to become sick again. It causes them to go back into hospital for further tests and treatment. It can undermine patients' confidence in their treatment. It can be life-threatening. Currently, we have no preventative strategy for TB-IRIS, and that's what we are evaluating is whether prednisone prevents TB-IRIS. And so that half the participants, half of the 240 patients will receive prednisone and half will receive placebo. So this would be the first evidence-based intervention, if we show that it works, to prevent TB-IRIS, and therefore it would influence international guidelines for the treatment of HIV-TB. Khayelitsha is a community just on the outskirts of Cape Town. It's a community of 500,000 people with very high rates of unemployment and has extremely high rates of TB and also a high prevalence of HIV. The PredArt trial is being conducted at Site B HIV-TB clinic in Khayelitsha. It's now an integrated HIV-TB clinic where patients can receive treatment for both the HIV and TB. If patients are willing to participate, they then go through a screening process. If they are eligible for the trial, there's a consent process that they go through to ensure that it's a voluntary process and that they fully understand all aspects of the trial and all aspects of their disease process. We have 2 counsellors, lay counsellors, who are people trained in counselling people about HIV, about TB.
These are our consent forms, the one what we are using for enrollment. At any time, they are free to not to participate in our study.
Then there's a study nurse who's also involved in counselling and supporting patients. She would also be involved in taking samples, blood samples and sputum samples from patients. The other doctor is a PhD student from the Institute of Tropical Medicine in Belgium.
We just need an X-ray on a patient, please. Nasreen is our radiographer and she will come and do the X-ray on our patient for us.
Those lymph nodes, the lymph glands, have enlarged slightly.
After examining her and talking to her, I think she may have developed TB-IRIS.
Patients are seen on the day that they start antiretroviral therapy. They're seen at 1 week, a 2-week visit, a 4-week visit, an 8-week visit and a 12-week visit. And at each visit, they get asked about their symptoms, how they're doing on the treatment, and we evaluate whether they are developing TB-IRIS or other complications. Throughout the trial, they will have bloods taken at most of the study visits in a standardized way. They will have X-rays done. If they're still sick at 12 weeks, then we would extend follow-up. And really, the key thing that we're assessing is who develops TB-IRIS and who doesn't develop TB-IRIS. And we're carefully evaluating for side effects at each study visit. Yolisa is our study nursing sister, and one of the things that she does in the study is to take bloods from the patients. This blood tube is sent to the laboratory to test the patient's blood glucose, because one of the potential side effects of prednisone is that it can cause the blood glucose to increase and can cause a diabetic state, and we're just monitoring very closely.
We store cells for future analysis. We have a PredArt book. It's a lab book. Once we receive the sample and we've checked that this sample correlates with a transport book as we receive the sample.
Once we finish seeing the patient, we've dispensed their medicines, we're sure they understand all the procedures and medication well, then we just sit down for a folder check to make sure that we did complete all the relevant documents properly.
And then there's a data coordinator who's involved in the administrative aspects of the trial, making sure that the data is collected in a standardized way.
Data management is so important because all the information that they've been collecting about the patients is kept on the electronic database so that at the end of the study they can compile the results.
In order to diagnose TB-IRIS, we need to exclude the other things that can make a patient sick. So this is one of the tests that we do as a blood culture to make sure that it's not a bacterial infection that is causing them to be sick. And if that's negative, then we can more confidently diagnose TB-IRIS. EDCTP are the funders of this trial, with co-funding from the South African Department of Science and Technology. They've allowed, through funding, the staff who are working on the trial, through the databasing, the blood tests, the data management systems, they've really allowed this trial to occur. So we're extremely excited about EDCTP2 and the renewal of EDCTP and the next phase of funding, because this commitment to funding research in TB, HIV, malaria, and neglected infectious diseases in Africa will provide a huge impetus towards us better understanding these conditions and better able to prevent and respond to those major public health problems in Africa, and also that it's done by scientists within Africa, addressing the questions in Africa and having the capacity in Africa to do that. And EDCTP2 will really give us the opportunity to do that.